Hi, in this video I'd like to talk about menopause and menopause management. Menopause is a very common condition amongst women towards 40s or in their 50s where they no longer experience any menstrual cycles anymore. So by definition, when we do diagnosis for a patient who has menopause, we will need to know that there is no menstrual cycles for 12 months in a row, for a year, and then we will actually diagnose that this is actually menopause. And then also we will take a look at the patient's age, usually around their mid-40s to 50s. So this condition is completely natural. You don't need to be worried, although it does bring some complications to your life. It affects the quality of your life. For example, it can lead to emotional instability, depression in some women, and then also hot flashes, and so insomnia, and a lot of different side effects. So here at Antai Hospital, we have been offering this effective management for women who are going through this phase to help them in this transitionary phase, and also restore some energy levels and also their youthfulness, because women who go through menopause, you will realize that they begin to lose a lot of their physical qualities. For example, they will have dry skin, their hair is very thin, maybe, or sometimes also shedding. Then they have osteoporosis, which means they cannot do intense physical activity anymore. Furthermore, they also begin to gain weight because metabolism has slowed down, and then the depression and emotional instability can cause some problems in the family, and also maybe in the workplace, in society in general. So this is quite a serious problem that we do need to take seriously. So symptoms of menopause, as we mentioned a few before, I'd like to mention again. So the first one is hot flashes. You will wake up in a bed of complete sweat. That's hot flash. Secondly is night sweats. Thirdly is insomnia. Fourth is gain of weight because of slowed metabolism. Fifth is the drop in your sex drive, or you have no interest in sexual intercourse anymore. This is also another common symptom. And then you will also experience vaginal dryness, skin dryness. This is also another symptom of menopause. There's a list of symptoms that we can go through, but these are something that generally that we can observe in these patients. So what is the cause of menopause? Menopause is happening because the ovaries are no longer producing estrogen and progesterone anymore. So the main cause is actually the ovaries. They are done functioning. They no longer need to ovulate, so they no longer need to release these hormones. So that's what's causing it. Some other causes that are acquired, for example, if you undergo any surgery of the ovaries, where the ovary is removed, then this can actually trigger pre-menopause or menopause in much younger women because the surgery is done. Another cause is also if you have undergone any chemotherapy, the medication that they give you can actually affect ovarian function, causing this induced menopause is what we like to call. But most often when you get off the medication, then the ovaries will start ovulating normally again. And the last cause is POI, which is premature ovarian insufficiency. This condition can happen in young women, and it can cause menopause because the ovaries are failing at a much earlier age. Women in their 20s and 30s are no longer secreting these important hormones, leading to menopause as well. So here at Antai Hospital, once we've done the proper diagnosis, management, there can be a number of ways, but in generally we have two ways. The first way is not so common, and we don't really recommend to our patients, which is the transplant of ovaries. First of all, it is very difficult to find a healthy ovary, especially one that is matching, has a high donor to recipient match, and then the surgery is also very technical and also very expensive. It's unlikely that you will find a donor that is willing to give you part of their ovary, and then for it to only last for a few years. And we also cannot guarantee the success of this surgery because rejection from the body is also very likely, unless you have found a very high match percentage from a donor. We cannot guarantee success for this organ transplant, so we don't really recommend it. The second management is the most common one and also more effective, and can be recommended to anyone who's going through pre-menopausal or menopausal. So here at Antai Hospital, our philosophy is that since you are lacking these hormones and neurotransmitters, we simply just supplement whatever you are missing. But we do it very carefully. We need to supplement it to a specific level. So reference is that we want to match a woman who is in her fertile periods. For example, in somebody who's in their 25 to 35 age period, they have high levels of progesterone and high levels of estrogen and other neurotransmitters, then we will use this as a reference point. Every person might have a slight fluctuation in supplementation, but in general this is our rule of thumb. And then we will also give you medications such as vitamin B12, folic acid to actually increase neurotransmitters that you are lacking. For example, serotonin, dopamine, these will actually help you with your emotional instability and depression. So in general, once we do this in women, these women actually begin to ovulate and see menstrual cycles again. They gain energy levels that they lost. They no longer have any symptoms of menopause. They feel much younger, much healthier. They no longer have osteoporosis, and they can go on to function much better as a member of society. So this is our effort in helping women, especially dealing with something so difficult such as menopause, and it is highly effective with minimal side effects. Some people believe that supplementation of hormones may lead to potential cancer, but this is because it is done the wrong way. If you do it accurately, only supplement them to a specific level, not too much, not too less, it will cause no complications. So if you'd like to find out more information about this menopause management with Antai Hospital, please arrange an online consultation with us to see how we can help you, and also leave me a comment down below.